Welcome to the deep dive. Today we're tackling something really fundamental in healthcare quality improvement. It's all about how we actually shift behaviors, on the ground to give patients better care. You've shared some great resources on this, and our mission today is basically to pull out the key ideas and, the practical strategies you can actually use to drive change that sticks.
Yeah, it's interesting, isn't it? When we think about improving healthcare, our minds often jump straight to, say, new gadgets or updated guidelines. But these sources really hammered home that lasting improvement, it really hinges on the everyday actions, what individuals and teams actually do.
Absolutely. I mean, you can have the most advanced systems, the most evidence-based policies you can imagine, but if the nurses, the doctors, the whole team aren't actually, doing those things day to day, well, you just don't see the results you expect. It's clear that simply telling people what the new protocol is, that's not the answer, is it?
No, not at all. Just sending out a memo or doing a quick training session, it often just doesn't cut it. Real behavior change means we have to understand what actually motivates people, what are the real barriers they're facing, and then we need to actively build an environment where doing the right thing, the better practice, feels like the easy, natural option.
Okay, let's really dig into that. Why is focusing on behavior change just so vital? Sometimes it feels like the people part gets a bit lost with all the talk about systems and tech.
Well, just think about a really well-designed protocol, maybe for stopping hospital infections, perfect on paper. But if staff aren't consistently doing the hand hygiene steps every single time or following the procedure exactly, well, the risk is still there. The sources really point out that even brilliant systems depend entirely on whether people actually follow through with the day-to-day actions.
That makes total sense. It's not just knowing what to do, it's the doing it consistently.
Yeah.
So what are some of the core ideas, the theories, that help us understand how this change actually happens?
Yeah, there are a few key models that are really helpful here. One big one is the COMB model, COMB. It suggests that any behavior happens because of three things interacting: capability, opportunity, and motivation.
Okay, break that down a bit. Capability. It's like, do I know how to do it? Do I have the skills?
Exactly, knowledge and skills. Then opportunity is about the environment. Is it even possible? Are the resources there? Is there time, social support, that kind of thing?
Right. Like, do I physically have the hand gel available right where I need it?
Precisely. And the last one, motivation. That's the want to, the drive, the belief that it's important, both conscious and maybe subconscious stuff too.
So using COB, if a new practice isn't catching on, we need to figure out why. Is it a skill gap? That's capability. Or is the workflow just making it impossible? That's opportunity. Or do people just not see the point? Motivation. That helps target what you actually need to fix. Okay, what else? Any other useful frameworks?
Another really important one is the stages of change model, sometimes called the trans-theoretical model. It basically says people move through different phases when they're adopting a new behavior.
I think I know this one. Like, first you're not even thinking about it.
Right, pre-contemplation. Then you start thinking, maybe I should. That's contemplation. Then you get ready, preparation. Then you actually do it, action. And finally, you work to keep it going, maintenance.
That definitely feels familiar from, trying to start exercising or something. It really shows that you can't just treat everyone the same when you're trying to implement something new. You have to figure out where they are on that journey.
Exactly right. So your strategy needs to match the stage. If someone's in pre-contemplation, you might just need to raise awareness, plant a seed. But someone in the action stage, they need practical support, maybe feedback to keep them going.
Makes sense. And there was one more model mentioned, the BJ Fogg model. What's the gist of that one?
Yeah, the Fogg model is quite elegant, really. It boils behavior down to three things happening at the same time: motivation, ability, and a prompt, or a trigger.
Motivation, ability, prompt, all at once.
Yes. And a really key insight from Fogg is about the ability part. Often the most effective thing you can do is make the desired behavior super easy. It's often much easier to simplify the task than it is to try and massively boost someone's motivation, which can be really tough.
So lower the barrier, make it simple, give a clear prompt. That sounds very practical. Okay, now we've got these models in our heads: COMB, stages of change, Fogg. What are some actual concrete things healthcare teams and organizations can do to drive these changes?
Well, the sources highlight several practical tactics. A really fundamental one is just make it easy. That means simplifying processes, maybe using checklists, job aids, putting reminders right where people need them.
Yeah, that links straight back to Fogg's ability, doesn't it? If it's easier, it's more likely to happen. What else?
Another powerful one is make it visible. This could be posting performance data publicly, like those hand hygiene rates you sometimes see, or just celebrating when things go well, sharing successes. It creates a kind of social awareness.
There's definitely a social aspect there. Knowing your colleagues can see the results or that the team is working towards something together, that can be a big push, right?
Huge. And tied into that is using peer influence. Find those early adopters, the respected clinicians who are already doing the new thing, and get them to be role models, champions, essentially.
We hear about champions a lot in quality improvement. This gives a clear reason why they're so important. Okay, what about feedback?
Absolutely critical. You need good feedback loops.
Yeah.
Giving people timely, regular information on how they're doing. That could be through dashboards, quick daily huddles, visual boards on the unit. It lets people see the impact of what they're doing and adjust course.
Yeah, it gives people ownership, doesn't it? Lets them see their contribution. Any other tactics?
Definitely recognize and reinforce. Don't underestimate the power of acknowledging when people are following the new protocol. Simple appreciation can go a long way. And just as important is to address fear or inertia. People might resist for good reasons. You need to listen to those concerns, maybe in listening sessions. Acknowledge them. Don't just dismiss them. That builds trust.
That empathy point really struck me. One expert in the resources really stressed understanding the context people work in. You know, a nurse with a massive workload might resist something new, not out of stubbornness, but because they genuinely don't see how they can fit it in.
Exactly. It's about understanding their reality.
And that expert also talked about positive deviance, which I thought was fascinating, instead of just focusing on why people aren't doing something.
You look for the ones who are succeeding, even in the same tough environment, the positive deviants, and then you study them. What are they doing differently? How can we spread that success?
It's a great way to learn from within. Find the bright spots. The sources also had some good concrete examples. Can you share one or two?
Sure. For hand hygiene, one place used really brightly colored sanitizer bottles right by the door. Hard to miss. That's making it visible, and a prompt. And they'd publicly thank staff seen using them. Simple but effective reinforcement.
Okay, visual cue, easy access, social reinforcement. Nice. What about something else?
Timely patient discharges. One hospital added estimated discharge today as a standard item in their morning huddles, and they used daily dashboards. It prompted the team to plan ahead, making the discharge process smoother.
Again, integrating it into an existing routine, the huddle,
Yeah.
makes it easier to adopt. There was one about documentation too, right, for residents.
Yeah, improving documentation compliance. They gave residents monthly report cards. These showed how they were doing compared to their peers. Kind of gamified it, made it a bit competitive and more visible.
A bit of friendly competition. Okay, so those are great specific examples. Now, stepping back a bit, the sources mentioned that quality improvement often relies on things like education, persuasion, maybe incentives. How do those fit with these behavior models?
Well, they definitely have a role. Education builds capability, right? Gives the knowledge and skills. Persuasion, like reminders or explaining the why, can boost motivation and act as prompts. And incentives, well, they're an external motivator. But the key thing we've discussed is that their success often depends on whether they actually address the real underlying COMB factors. You can educate all you want, but if the opportunity isn't there.
Right, if this system makes it hard, education alone won't fix it. Got it. The sources also mentioned something called BCTs, behavior change techniques.
Ah, yes. BCTs. Think of them as the specific active ingredients within a bigger intervention. So things like setting clear goals, helping people problem solve barriers, getting them to self-monitor their behavior, giving specific feedback. Those are all BCTs.
Okay, so an educational program might use the BCT of goal setting to make it more effective. It's the specific tool within the broader strategy.
Exactly. It makes the interventions more precise and evidence-based.
And where are these principles being applied? I mean, beyond specific projects.
Oh, all over. Think about clinical practice guidelines. They can be written specifically to make the desired actions clearer and easier to follow. Patient-centered care is huge. Empowering patients to manage their own health involves changing their behavior using these same ideas. And there's organizational behavior management, OBM, which looks at changing systems and processes across a whole organization to support better staff behavior.
So it really scales from individual actions right up to the whole system. It emphasizes creating that environment where the right thing is the easy thing, What about the tools people use to actually do this implementation work?
Well, standard quality improvement tools are key. PDSA cycles plan, do, study, act are perfect for testing changes on a small scale. Lean and Six Sigma methods help streamline processes, removing those opportunity barriers. And tools like fishbone diagrams or driver diagrams help you diagnose the root causes, figuring out which COMB factors are really at play.
So the QI methodologies provide the structure for applying these behavioral insights. It's not just theory, there's a practical way to do it. But it's never totally straightforward, is it? What are the common roadblocks?
Oh, definitely challenges. Lack of knowledge or skills, that's common. Resistance to change is the big one, often stemming from those fears or perceived barriers we talked about. And organizational stuff, lack of resources, too many competing projects, leadership not fully backing it. Overcoming these takes persistence, good communication, and addressing those root causes.
And the ultimate goal isn't just a temporary fix, right?
Yeah.
It's making it stick. Sustainability.
Exactly. That's about embedding it in the culture. Ongoing feedback, continued reinforcement, making sure it's part of the normal way of doing things, built into systems and routines.
Okay, this has been incredibly insightful. A real deep dive into how behavior actually changes in healthcare settings. If we were to boil it down, what are the main takeaways you want people listening to walk away with?
Okay. 3 things maybe. First, think beyond just teaching or telling. How can you engineer the situation so the right behavior is the easiest path? Second, start small. Get some quick, visible wins. That builds momentum and motivation like nothing else. And third, always remember how much the environment and the system shape what people do. Often, changing behavior means changing the system and the cues around people.
Fantastic summary. Make it easy, start small and visible, and change the system. Really actionable points. So here's a final thought for you, the listener, to chew on. Think about your own workplace. What are the subtle cues, the unspoken rules or norms? How might some of those, maybe unintentionally, be keeping old habits alive? And what seemingly tiny change in the environment, maybe just rearranging some equipment, tweaking the wording on a checklist, adding one item to a meeting agenda, what small shift could trigger a surprisingly big positive change in behavior? That's the deep dive for today. Thanks for joining us.